Protecting your kidneys is not just about your kidneys. It is about protecting your entire future, because when kidney functions start to fail, the damage doesn't stay in the kidneys alone. It quietly spread and affects almost every system in your body. And do not forget that your kidney controls your blood pressure, it controls your heart health, your bone strength, your hormone, and even how clean your blood stays. So when the kidneys suffer, your risk of heart disease increases, your bones weaken, blood pressure rises, and the hormones go out of balance. That is why kidney disease prevention matters so much. So in this video, I will share simple kidney protection checklist you can start using today. And we will cover three main areas. We will look at common medications that can silently damage our kidneys. We'll look at the foods that protect our kidneys and the foods that can harm our kidneys as well. And the last one, we will look at the best type of exercise for kidney health. And if you already have kidney disease, this information is going to be helpful to you, because these steps can slow down or even stop further damage to your kidneys. And now note, this video is for education only and not medical advice. Always talk to your doctor before making health changes, okay? Let's go straight to the point. Common medications that can damage kidneys. One of the most common causes of kidney injury is medication, both over-the-counter medication and the prescription drugs. In fact, studies show that up to 1 in 4 cases of acute kidney injury in hospitals are drug-related. So we are looking at a group of drugs or medication like the NSAIDs, which are mostly over-the-counter pain relievers or painkillers. So these include ibuprofen, naproxen, and diclofenac. These medications reduce pain by blocking prostaglandins, okay? And inside the kidneys, prostaglandins have a protective role. They keep the tiny kidney blood vessels open. They maintain adequate blood flow to the nephrons of our kidneys. So when you take NSAIDs or painkillers and block prostaglandins, even though your pain and inflammations are going to reduce all right, but these medications are going to cause kidneys blood vessels to narrow. Blood flow to the kidneys are also going to stop, and these can trigger acute kidney injury, especially in vulnerable people. That is how serious it can be. The problem here is not the pain or the inflammation being blocked. It is the loss of prostaglandin protection in the kidneys. That is what matters. Think of it like this. Painkillers may relieve your headache, but they squeeze the blood vessels your kidneys need to survive. Your kidneys are going to struggle. Nobody is saying stop taking them completely. Occasional use of this medication is usually safe, but frequent or long-term use is dangerous, especially if you have high blood pressure, if you already have kidney disease, okay? If you are dehydrated, and if you take diuretics, it is going to be dangerous for you. So you just have to avoid them. And the second group of medications we are going to be looking at are the medications that are used to treat heartburn. So we are looking at the proton pump inhibitors or the acid suppressors, drugs like the omeprazole, the Nexium, the pantoprazole. You understand? These medications don't fix the cause of heartburn. They just hide the symptoms, and it will look as if the cause has been treated, you know, but the cause will still be there. Recent safety reports show that proton pump inhibitors are among the top drugs linked to serious kidney injury. So they should be used only when necessary. They should be taken for the shortest possible time. Long-term, unnecessary use can silently damage the kidneys. And the next group of medications are certain antibiotics like the Bactrim. Bactrim is commonly used for treating UTI, skin infections, ear infections, okay? And here also, studies show that 1 in 10 people who use it for several days may develop kidney injuries. Sometimes it is just needed, but it should not be the first option when alternative exists. Are you getting it? You cannot risk your kidneys Even the slightest damage to your kidney is a big deal. Let me tell you why slightest damage to your kidney is a big deal. Your kidneys are made up of millions of tiny filters, more the nephrons, okay? Each nephrons work independently. Imagine a workplace. When all workers are present, work flows smoothly, okay? When workers quit, remaining staff are overworked, and over time, burnout causes more workers to fail. That is exactly what happens in the kidney. Once some nephrons are damaged, the remaining ones are forced to work harder. That will speed up kidney failure. That is why even the smallest damage matters. So let's move to the second part of this video, which is the foods that can protect or harm our kidneys. So let's look at the foods that can protect our kidney. So we are looking at leafy greens like the tomatoes, we are looking at carrot, avocados, mangoes, pawpaw, cocoyam leaf, which is kotomle in Ghana. We are looking at the jute leaves, ayoyo or ademe. We are looking at the African eggplant, which is boma. We are looking at pumpkins, cucumbers, sweet potatoes. We are looking at red bell peppers. We are looking at grapes, oranges, kiwi, watermelon, broccoli, Brussels sprout. These leafy greens are rich in potassium, which is healthy for the kidneys. This is because potassium relaxes the blood vessels, it lowers blood pressure, and it helps remove excess sodium from our system. But note, if you already have kidney disease, potassium may need restriction. Always make sure you work with a healthcare professional. So the next one is too much salt. High sodium raises blood pressure, and high blood pressure is the second leading cause of kidney disease. I will recommend you take less than 2,000 milligrams of sodium per day, even lower if you have hypertension. But this is where the problem is. A lot of people think when we talk about salt, then their concentration is on the advanced salt or the iodinated salt or the salt shakers. No, rather, beware. Most of the salt do not come from the salt shakers. They rather come from the packaged foods, the fast foods like the fried rice. They come from the processed meat, instant meals and sauces like the instant noodles and indomies. So make sure to reduce this processed food to protect your kidney, your heart, your blood sugar, and also your overall lifespan. Now, let's look at the best exercise for kidney health. The good news is that you don't need intense workouts at all. Studies show that walking regularly slows down kidney decline. Just 30 minutes of aerobics activity improves kidney function. Consistency is what matters, not the intensity. Walking, jogging, dancing, any movement counts. You just have to be consistent with it. And that is really going to improve your kidney health. Your kidneys work silently every single day to keep you alive. Protecting them today means better health. It means stronger bones. It means stable blood pressure. It means a healthy future. So take care of your kidneys and they will take care of you. Make sure you share this video to as many people as you can. Like the video and also make sure you follow me if you have not for more health tips. I will see you in my next video. I'm out.